these kids had various developmental deficits in the areas of verbalization, understanding, focus, initiative, social interaction, and some also show lack of eye contact, avoidant or withdrawn behavior, irritability, hyperactivity, inadequate verbalization, aggressivity. So there are myriad manifestations of this developmental disorder, and I can say that so far I have not seen two kids with deficits of the same type of amplitude. Parents are usually the first to notice that something is unusual with their child. The child does not talk, does not look when called by name, does not hug, nor initiate contact with mother. This happens usually at around the age of 1 year. The main treatment option today is psychotherapy, and it has shown good results, especially for children with minor to moderate impairment. And even dolphin therapy, it happens. And I decided to go for this treatment knowing that autologous cord blood carries little risk, and we administered the cord blood to a very agitated and uncooperative child who fought the intensive care doctor to her best abilities, and 1 month afterwards we had the first follow-up visit. And I was very surprised to see a very changed child, a very different child from previous visit. She was making eye contact, smiling, responding to requests from parents, speaking when prompted, totally something else. Cord blood has different types of stem cells in different proportions, and currently we determine only the total nucleated cells, or TNCs, and the hematopoietic stem cells, or HSCs, which have the cellular surface marker CD34. And this because they are used primarily in hematology oncology for reconstitution of bone marrow after high doses of chemotherapy. Some cord blood grafts contain stem cells with embryonic markers, NANOG and SOX and OCT, which are even more capable of division and differentiation into many cell types and are able to replace the neurons destroyed in ASD. Younger children getting good and sometimes exceptional results, children younger than 7 years old, and older children having a much lower rate of improvement after treatment. Of course, the use of autologous cord blood is limited to children who have it harvested at birth, as the pathology itself is very different from child to child, as we said in the beginning. However, the autologous cord blood has the big advantage of minimal risk to the child, which is very important considering the unknowns and the very young age when it is administered, and the fact that it is a non-life-threatening condition.